mental exposure increases the risk. Now, there's some things that are identified as risk factors. In other words, the presence of these factors increases the likelihood, but doesn't clearly cause the disease. So even though aging is not a cause, the fact that the majority of the patients are in the elderly age group indicates that aging is the strongest risk factor for Alzheimer's disease. And then people with certain conditions, like children who have Down syndrome or people who have Down syndrome, develop Alzheimer's dementia at a younger age than the typical 65 and above. The presence of certain risk factors like diabetes, high blood pressure, abnormal cholesterol, those are also risk factors.
We have a call coming through. Hello, who is calling? Hello?
Hello.
Hello. Your question, please.
Hello.
We can hear you. Ask your question.
Okay. My name is Omowale.
Yes.
Yes, my question, actually, before I ask my question, I want to say hello to Dr. Okumbadejo. She's my mother, also at Luke. And we've had wonderful improvements with her in the last 1 year since Dr. to handle her. But what can we do about the public perception of dementia? Because before we came to you, a lot of the consultants that we had talked to actually felt like they had a problem, and you, of course, did all the tests and everything. And looking back where we are now, it's not even up to 1 year because we came to you in May. We've had and people's perception of how it's better. But I look at it as that's just an isolated case. What happens to so many other people? Do you have an association that can
Thank you very much,
and let people know how to handle their aged people better?
Thank you. We'll take it from here.
I'd like to say thank you, Dr. Okubadejo, for the good job you've done with our mothers.
Thank you.
Now, we were going to get to this point.
Yes.
Public perception. Like we said, some people will think this person is going mad.
Exactly. I think that part of that is that there's a lot of unawareness, not just about dementia, but about many, many medical conditions in our society. And it's not germane to Nigeria. There are many other cultures where they don't understand dementia. So the thing is, to improve public perception, we have to improve the awareness, first of all, that this condition does exist. And then from there, people begin to suspect it and begin to seek medical advice when they suspect or think that somebody has dementia, particularly when they're dealing with elderly people. To get some help for someone who has dementia or suspected dementia, I think one of the easiest ways is to approach either a teaching hospital or a neurologist in general practice or a federal medical center, for instance, and then let them at least do an initial assessment to determine whether there's something to worry about or not. Okay. And then they can take it from there.
Thank you very much. Now, from what we've discussed, somebody with dementia can easily be a danger to himself and probably to others around him.
That's true.
So what happens in our very busy world, our very busy day, when everybody has to go to work and probably leave this person behind in the house, who cannot remember, for example, that she's warming something in the kitchen, or forgets where she is at a point and just wanders off? How do we handle such situations?
The management of someone who has dementia is much deeper than issuing drugs. In fact, I try to encourage patients' relations and say the pharmacologic treatment or the drug treatment, put it down to the bottom 10%. The majority of what you need to focus on is caring for the patient and safety.
We have another call coming through. Hello. Hello, we can hear you.
Hello.
Hello. Speak.
Hello.
We can hear
Good
you.
afternoon.
Good afternoon. What's your name and your question?
Coming from Nigeria.
Okay.
Yeah, I said, are you hearing me now?
Yes, please go on.
Is the dementia can categorically where somebody can just, there is a friend that used to complain some symptoms about this thing that you are saying. So, I don't know how such a thing can be cured.
how dementia can be cured?
Yes. Because there is a chance to look at the people
Okay, thank you, Ike. Thank you.
Okay, so IK, many people may have memory complaints throughout their life. It's not all those people that have dementia. The problem with dementia is mainly elderly people, but also if you notice that the memory complaints are becoming frequent and actually interfering with the person's ability to function independently, look after themselves, go to work and so forth. If somebody who used to be able to calculate money very well is now not able. So it has to be a decline from how the person has been functioning before. It's not somebody, if you have somebody who from time has not known mathematics and then later on still doesn't know maths, we can't label him dementia because of that. But it is a decline from how the person was functioning before. But if the person is worried, like I said, they can approach a doctor, start from there, and then they can be referred to a neurologist or even a psychiatrist who will know how to evaluate them properly.
Okay. Now, we were talking about the care, and I want to ask, when everybody in the house goes, some are going off to school, some are going off to work, and this older person, this older adult or senior is in the house and probably can't remember the way to the bathroom. Should we begin to think of settings where we can take such people to, just to make sure they are safe before everybody comes back home? Should we be thinking of things like that?
We should. Safety is a major issue for people who have dementia. I'm sure sometimes you see in the news an elderly person found missing, and because they can't remember, they may not remember their names, they may be confused, or their addresses, they may end up...
Oh, even that?
Yes. So many of those elderly people who are found wandering may have dementia. And so you will not be able to trace their relations and so forth. And it's simply because somebody wasn't watching when they walked out. And this is apart from the fact that they can have self-injury, burn down the house, and so forth. So it's important to provide safe care for people who have dementia, to be sure that somebody is looking out for them. And if you're in a living situation where there will be nobody in the house, you shouldn't actually lock them up in the house and go away, because other things can happen where they're locked up. It might be important for us to begin to look at that option of daycare for the elderly.
Okay, you mean like what we do for children?
Like what we do for children.
Take the person for the day, then pick the person up on your way back home.
Exactly. So take the person to somewhere that is safe, where they're well looked after, where somebody will ensure that they're fed while you're out of the house, and then take them back home at the end of the day. So I know that there are not many of those facilities, but I know that one or two have begun to spring up like that. I know that culturally we have this burden on ourselves to be the direct caregiver.
That's right.
When someone is ill.
People think you're wicked. You're shipping your dad off to some place where strangers are taking care of him.
Right. But the truth is you can't be breadwinner and direct physical caregiver and emotional caregiver all in one. You will break down, or you will lose that job and then not be able to provide financially to care for the person. So it's important to have a balance where if you're a caregiver, you need time out to rest. If you're the financial provider for the family, you can't do all those tasks. So you need to look for sources of support where your loved one is safe while you're out making money to support them.
Okay. So does it not create a problem when you have to take your loved one to a place outside the house? It's totally different. It's not like the atmosphere of the home where they're used to. They're already losing their memory, having problems, and then you take them to an all new place. Doesn't it affect them?
Now, ideally, somebody who has problems with memory, dementia, as much as possible should stay in their comfort zone. But safety is also paramount. So it's in our culture, before we had a situation where we had a lot of social support. But as things have begun to emerge and the economy is changing, many more people will not agree to stay at home and look after an elderly person as a full-time job. So even though it's safer to have them in the confines of their home, in their comfort zone, sometimes the situation will warrant that you need to take them out. They do get more confused when you take them out though, because then they have to learn new memories, learn the new environment, and that's difficult for them to do. So it's about looking for what will work best. In other societies, they have the option of taking them to an old people's home, but I know that our culture, they will scream blue border if you attempt to take your relation.
Perhaps the daycare thing will be more acceptable. Or you bringing somebody to the home.
That's also a very good option. But making sure that the person is empathetic, is caring, and will provide safety for that elderly person. Not someone who will come and take advantage of the elderly person, because they won't even remember what exactly has happened, but they'll just become more reclusive and more
these are people who can
aggressive.
Forget your name or something. The director is telling me I've got to stop, so that last question cannot go. Thank you so much for coming.
It's
been a pleasure.
Thank you.
Enlightening us on this topic that seems so, so blurred, should I say, in our society. Thank you very much,
Dr. Mary,
for coming.
Thank you, my pleasure.
Thank you for being with us, all of you, and all of you who called Omowale, and I don't know whether it's Ike or Ike, well, whichever. Thanks for calling, and let's do it again. Enjoy the rest of your day. I'm Mary Alale Yusuf.